Welcome back to Beyond the Stethoscope. Over our series, you have heard about many of the departments that hospitals have. Some that come to mind may be the emergency department, labor and delivery, trauma, and more. But there is one crucial department that plays a role in most, if not all, departments across the hospital: environmental services. These colleagues support operations not only by keeping patients' and guests' areas clean, but they play an even larger role in ensuring health and safety across our campuses. Today, Senior Director of Environmental Services at Trinity Health Mid-Atlantic, Rasan Alexander, explains the important role his team plays in everyday operations. Rasan, thank you so much for joining me.
Thank you.
Great to have you here. I'm really looking forward because this is a department that I know is so crucial, but I don't feel I know a lot about, and I'd love to educate our viewers as well. So could you tell me first about your role?
Absolutely. So as a senior director, I oversee the four Trinity campuses in the Mid-Atlantic. That includes our Darby location, Mercy Fitzgerald. Down in Wilmington, Delaware, we have St. Francis. Going further north, Nazareth, which is in North Philadelphia. And last but not least, our Langhorne campus, which is St. Mary's Medical Center.
Got it. And how do you all, like your team and your colleagues, how do you serve those campuses?
Oh, wow. So that's a great question. So the big thing for us is just making sure that we're keeping our community safe. And that is so when anybody comes into the hospital, we want to ensure that they have a very pleasant, safe experience as well. So making sure we ensure and carry out those different infection control policies and standards, that's probably the biggest thing for us, just to ensure that our colleagues, our patients, and then anybody else who comes to the hospital are in a great space and they can leave out very healthy.
Cool. So you touched on something. So you said infection control. Can you expand a little bit on that for me? Like, what does that exactly mean for your staff and patients?
Yes. So infection control, it's a lot of different facets to that. The biggest thing for us is to making sure that we're going to disinfect properly. So a lot of different research goes into the different things that you can acquire in a hospital or what you may look to try to combat in a hospital. So huge shout out to the team that we do have at the system office. They do endless research on making sure that we're up to date and all of the innovative processes are there for us to make sure we carry out this just from a great top of the line perspective, down to the chemicals that we use, making sure that they're safe for the patients, making sure that we're killing the right different germs, making sure that we're doing these things, the policies. It's a long process, but it's one I could go on and on, but it's pretty exciting.
It sounds incredibly involved, and that's one thing that just as a person, like every flu season, I'm challenged because I feel like I get the flu shot and then it morphs because that's what germs do. So I'm sure it really keeps you all on your toes in terms of, like you said, your research. And how do you implement that research? So you mentioned the research team. So how does like the day-to-day, like what sorts of policies and procedures, like would I expect?
Just from that, from a policy standpoint, the biggest thing for us is to drive our operations and programs. Our people are the foundation of what we do, but we want to make sure that they're educated when they go to these places, that they feel comfortable to carry out the different policies that we do have when we do clean patient rooms, public areas, ancillary spaces, et cetera, et cetera. So when we look at this at each individual campus, each layout is different depending upon the size of different things. So the level of staff or the amount of staff that we may have might be a little bit different, but the underlying thing of what we do remains the same, and that's disinfecting and making sure that we're keeping our patients safe.
Yeah, that's great. I know there's just so much in and out of patients and then their visitors. Of course, I've had the pleasure of meeting a lot of the staff of the various hospitals in your medical group, so I know that's a very involved job. So not only are you keeping everybody safe, of course, with infection control, but you all are a very forward-facing team. Do you want to talk a little bit more about, just kind of the interactions that you and your colleagues have with the day-to-day, like, inner workings of the hospital?
Yes. We actually get a lot of patient time. We get a lot of time to actually interact with the patients and then the clinical staff upstairs as well. So that way, it's always important that we build the proper rapport, especially with that, just having the teamwork so that we understand what's happening on the units. But if you go back and just to the day-to-day with the patients, you got to think about it like this. We're the only department to go in. We're not going to give you bad news. We're not coming in to poke you.
That's true. That's a good point.
Seriously, we're not coming in with anything that can be negative at all.
Right.
Only
like
thing
discomfort or anything.
No,
yeah.
not at all. We're one of the very few departments, along with us in food and nutrition, that we provide another aspect to the healthcare experience. And with that, it's a very positive one. So we look to engage with that patient. We understand that you're there and you don't want to be in the hospital right now. Things happen. We get it.
Things happen.
But we want to get you out safe. We want to get you out proper. And we also want to when we take those 1, 2, or 3 times that we're inside the room to clean, we want to make sure that we're there, we're interacting with you, we're talking to you on a day-to-day thing. I've seen a lot of positive experiences where our housekeepers have gone in and we've impacted a lot of patients in so many positive ways just by going and having conversations. But somebody say, hey, listen, how you doing?
Yeah.
Something as simple as that can go a long way. You don't know what that person has been there and what they're there for and what they're going through.
You're right. And just that face-to-face interaction, especially in something that can be considered kind of a sterile environment like a hospital, that warmth that your team provides. Speaking of which, I heard an anecdote in prepping for this episode about one of your colleagues playing a grand piano at St. Mary's. Do you want to tell me a little bit more about that? I feel like it went viral, maybe?
That was a bit crazy, right?
That's so cool.
It was I would say it was one of the better stories I've ever heard. And I've been doing this for 15 years plus. So when that story had broke, it was just a colleague up at St. Mary, and what he would do just on his off time, he would go and he would play the piano, and just the gravity it would pull towards him because of just how well he would do it, for one, and then two, he was doing it. This wasn't something that was paid for, and it was just, hey, listen, we just want to provide an experience and make sure that the people coming in, you hear something nice, hear something soothing and calm. And he provided that for those patients up there, and just it was nice that we were able to shine a light on that.
Oh, that's so neat. Can I find the clip on YouTube if I were to look?
I believe you can. Believe you can, yes.
Oh, I love that. Well, you've painted such a good picture for me in terms of, what your staff does, and then just kind of that extra mile, like you said, the face-to-face interactions with the patients. Is there anything else you'd like to add today that we didn't touch on?
So yes, I do. So one of the misconceptions is that EVS and transport, these are, and they're entry-level positions. But what I like to tell people all the time is that we are actually a feeder department for a lot of other departments within the hospital. And as we look to try to retain, or we try to bolster our recruitment, I like to let people know I've actually had the opportunity of colleagues coming in with me. I've seen them go on to become nurses. I've seen them go on to become top-notch clinicians. Whatever you want to do in the healthcare field, trust me, I've seen people come through our departments and do it. And the other thing about it is the ability to come and work as an EVS worker, the level of respect that you get for what they do, it just speaks volumes. And therefore, that teamwork is created and that bond is created throughout the hospital. And so you just see a nice connection from top to bottom. And in most healthcare facilities, this is what you want to see. That's what makes us successful. That's Trinity.
Yeah, I can't think of any other role where you get that much, like you said, respect, interaction. And as you said, if it is your entry point into the healthcare field or the administrative field, then that's an incredible place to start. Thank you so much. That's a great ending point. I feel really motivated. And thank you for just taking the time to educate me and our viewers today.
Oh, thank you. Thanks for having me.
Yeah, thanks for coming. So the next time you happen to be in a hospital, give a simple thank you to the EVS workers for the same commitment to your care and safety as your care team. And thank you for joining us on Beyond the Stethoscope. Make sure to hit the subscribe button to get our latest episodes every other Thursday.